Right, we're going to go through the GCSE paper 2018 paper 1. Two ways you can use the video. First of all, turn the sound off and go for the exam questions. Once you have done the exam questions, you then can put the sound on and we'll go through the mark scheme and the examiner's notes. Right, so question 1, describe the function of the alveoli. So we've got for the mark scheme, we're looking for any two of these in order to get your 2 marks. Allows gaseous exchange or diffusion, allows oxygen to diffuse, move into the blood and capillaries, allows carbon dioxide to diffuse, move the blood and capillaries. Okay, so the examiner, they say most candidates correctly stated that the function of the alveoli is gaseous exchange. Diffusion was an acceptable alternative for this. Higher ability candidates went on to explain that oxygen diffused into the blood capillaries and the carbon dioxide diffused from the capillaries into the alveoli. So question 2. Below shows a diagram of the heart. Identify the part of the heart that is labelled incorrectly. So the correct answer is D, or pulmonary vein, or vena cava is incorrectly labelled. Okay, so we've got here acceptable responses for this question gave the letter D, or stated that the pulmonary vein was the part that was incorrectly labelled. Some candidates correctly pointed out that it was the vena cava was labelled incorrectly, and although this was not required, gained credit for their response. So question 3, give a definition of a synovial joint. So the examiner says many candidates correctly stated that synovial joint is a freely movable joint and or is a joint that allows a range of movement. Some candidates stated that it is where 2 or more bones meet. However, this is a definition of all joints rather than a synovial joint in particular, so was too vague. Descriptions of the role of synovial fluid needed to be linked to a synovial joint and that the fluid enables free movement to take place to gain credit. So we're looking for the definition of a freely movable joint, or freely movable allows for movement. Number 4, a rugby player will use their shoulder joint when making a tackle. Name the 2 articulating bones in the shoulder joint that are at risk of injury during a rugby tackle. So the examiner notes, many candidates incorrectly named the clavicle, but this bone does not form part of the shoulder joint. Candidates are advised to learn the names of the articulating bones at the joint, which are listed in the specification. So the correct answer are the humerus and the scapula. Question 5, reversibility is a principle of training. Using a practical example, explain what is meant by the term reversibility. So, examiner's report, this question requires an explanation of reversibility as a principle of training and asks for this to be applied to a practical example. Marks were credited for saying that the benefits of training either skills or fitness components would be lost if a performer stopped training for a period of time. A practical example had to be used to gain both marks. A common error was the use of the word reverse in the answer. For example, strength would be reversed if a weightlifter stopped training due to injury. Because it's used in the question, you shouldn't really use it in your answer. Number 5, so the actual mark scheme. So 2 from 2 of explanation. Any performance fitness gains that has occurred through training can be lost once training has stopped, or training must be maintained to prevent the loss of performance or fitness. Example, appropriate practical examples demonstrating reversibility. It says, do not accept any references to physical adaptations, gains are reversed because it is in the question. Number 6, which one of the following shows the correct distance for the multi-stage fitness test and the test for speed? So this is just testing your general knowledge of ticking one box of the different fitness tests. The answer is C, 20 meters for the multi-stage fitness test, and it is a 30-meter sprint test. Number 7 shows a diagram of the lower leg. Identify muscle A and bone B. So, the examiner report, this question requires the correct names as listed in the specification. The candidate incorrectly named A as the calf and B as the shin. Other common errors included using the term fibia or tibia for the bones, to get the wrong bones. So the correct answers for 7, the muscle is the gastrocnemius and the bone is the tibia. Number 8, identify 2 potential hazards in a swimming pool. So the examiner's report, many candidates correctly identified a slippery wet surface, the depth of the water in the pool, the water quality, too much chlorine, or the action of other swimmers as potential hazards. Some candidates incorrectly identified risks such as drowning rather than the hazard. A hazard is the cause of the issue, whereas a risk is the potential consequence. Responses which stated a risk but also made reference to a hazard did gain credit. For example, slipping and banging your head on the floor because of a wet floor would have gained a mark. So we're looking for, if I'm going for mark scheme, slippery, hard, wet, damaged surface, loose fitting or equipment left out, too much chlorine chemicals in pool, overcrowded pool, ability, behaviour of other swimmers, depth of water, deep or shallow, dirty water, poor water quality, litter, debris and waste. It says do not accept consequences of hazards, e.g. slipping, falling, drowning and collisions. Number 9, using practical examples, explain the difference between the transverse and longitudinal axis of rotation. So, the examiner's report. This question requires candidates to describe the position of the transverse and longitudinal axis and give a practical example to show an understanding of a movement around each axis. Most candidates correctly named a somersault as the movement around the transverse axis and a pirouette as a movement around the longitudinal axis. Many responses also correctly stated that the transverse axis passes through the hips and the longitudinal axis runs from head to toe. Some candidates describe the transverse axis as one that passes through the center of the body. However, all 3 axes of rotation do this, and therefore this statement does not explain a difference between the 2 axes. Responses which include a diagram to show the position of the axis were credited if it was clear where the axis lay in relation to the body and the axis were clearly labelled. So the answers: transverse is side to side, hip to hip, left to right, and longitudinal is top to bottom, e.g. head to toe. Transverse, e.g. a somersault, a bicep curl, pedaling a bicycle. Longitudinal is a pirouette, a full turn, a flat spin, a twirl. Right, give a practical example where aerobic endurance is important in sport. So there's no examiner's report for this one, but the correct answers are any activity, event that requires aerobic energy production, e.g. a marathon, a triathlon, a 100-metre plus run to achieve a faster time in an event or activity. And 3, remain effective during a game, less fatigue during performance. Number 11, circuit training is a training method that consists of a series of exercise stations. Describe one other feature of a circuit training. So the examiner report for this, most candidates correctly stated that circuit training targets different muscle groups, had rest periods between stations, or that work at each station was for a set time. So our correct answers for this are main a specific different muscle targets at each station, or involves repetition of exercises, or body weight is usually the resistance, or each station is timed, or rest periods between each station, except any combination that includes at least 2 arm exercises. Moving on to B. Design a simple circuit training session to overload the upper body by completing the diagram below. Place one of the named exercises in each station. So the examiner's report, the vast majority of candidates correctly placed at least 2 upper body exercises in the circuit. A few candidates placed 3 lower body exercises in the circuit, and this may have been caused by not reading the question carefully enough. Many candidates underlined the key words in each question to avoid any such misunderstanding and to focus their answer on the requirements of the question. So the correct answer is accept any combination that includes at least 2 arm exercises. So we're looking for your bicep curls, your pull-ups, or your press-ups. Number 12, cartilage plays an important role in the skeletal system. Assess how cartilage helps a marathon runner during a performance. So, most candidates correctly stated that cartilage reduces friction between the bones of the leg and acts as a shock absorber to cushion the knee joints while running. Some candidates made one of these points and then repeated the same point using different examples from running. As a result, only gained 1 mark. So the answer: protects the knee bones or prevents friction or prevents bones rubbing, knocking together, or prevents wear and tear. 2, acts as a shock absorber, absorbs impact of running. 3, provides support and stability. 4, provides some flexibility. 5, aids mobility, movement at the joint. 6, help to connect some bones. 7, keep airways open. So 13, what class of lever will a weightlifter be using when performing a bicep curl? So the answer is a 3rd class lever. 14, the performer in figure 3 below has performed a movement that has passed through the frontal plane. Is this statement true or false? Draw a circle around your answer. There's no examiner's report, but the answer is true. 15. Which one of the following statements is false? The examiner's report. Similarly to question 8, a number of candidates were unable to differentiate between a risk and a hazard. Some candidates used a process of elimination to come to their answer by identifying the statements they thought were correct. So the answer on the mark scheme is C. A common hazard in rugby is concussion. Number 16 shows a diagram that highlights one plane of movement. Name the plane highlighted in figure 4 above. The correct answer for this is the transverse plane. Number 17. Describe a suitable cool down for a dancer. The examiner's report. Most candidates were able to describe suitable purpose, lowering and stretching exercises for a dancer's cool down. Some responses only described one exercise, either stretching or low intensity movements. Candidates are advised to check the number of marks available to each question to understand how many points should be made. So, the mark scheme: jogging, whole body exercises, low intensity movements, slow dance, and 2, stretching. Number 18, give a practical example of how an appropriate level of competition can prevent injury to a performer in a sport or physical activity. So the examiner's report. This question requires candidates to show an understanding of the way that sport may structure competition so that the risk of injury is minimised. The most common response refers to age, weight and ability categories and applied them accurately to a named sport. Some candidates made generalised comments about how injury may be caused by having different skill levels in a sport, and more specific description of how injury are prevented in that sport was required. So our correct answer for 1 mark: age, gender, weight, ranking, grading, skill, ability level. An example: boxing occurs in weight categories, e.g. you won't have a heavyweight boxer fighting a lightweight boxer. Football, less likely to be injured in a tackle if all participants are the same or similar age. 19. Figure 5 shows a picture of a foot and a long jumper taking off. Label arrow A and B to correctly identify the components of this lever system. So, examiner's report. Most candidates correctly identified A as the effort and B as the load. Some candidates understood the correct terms but put them in the wrong place. Candidates are reminded that the correct technical term must be used to describe the lever system. So we've already given the answers: A, effort, and B, load. So 20. The human heart is part of a single circulatory system. Is this statement true or false? Draw a circle around your correct answer, and the answer is false. 21. Explain the short-term effects on the heart and the blood of a swimmer performing a 100 meters front crawl. The examiner's report. Many candidates correctly stated that heart rate, stroke volume, and cardiac output all increased. Higher ability candidates explain these changes and others, such as why blood pressure and blood temperature increased, and some candidates describe the vascular shunt mechanism. So, looking through the mark scheme, 21, we have got increased heart rate, increased stroke volume, increased cardiac output, increases blood flow, oxygen to working muscles, directs blood away from other organs or less blood to other organs, increase in blood pressure due to increase in demand for oxygen from the working muscles, increase in blood lactic acid, CO2, because muscles are working, blood temperature increases to help control the body's temperature, vascular shunt or vascular shunt. Go from there. Right, it's 21. B. A swimmer who undergoes a 6-month training program will experience muscle hypertrophy. What is muscle hypertrophy. The examiner's report, most candidates identified that muscle hypertrophy meant an increase in size of muscle. Other acceptable answers include growth of muscle and increased mass. So the examiner's report just says muscle will increase in size, mass or growth. So point 2, describe other muscular benefits the 6-month training program might have for a swimmer. So examiner's report, the majority of responses describe at least one muscular benefit, usually an increase in muscle endurance. Many candidates also identified an increase in strength. Some candidates had defined muscle hypertrophy in the previous question as an increase in strength, and this may be why they did not give increased strength as a benefit in this question. So for the correct answer, we're looking for increase in power, strength, including tendon strength, increase in speed, increase in muscular endurance, increase in resistance to fatigue, increase in flexibility, range of movement, less chance of being injured, increased tolerance to lactic acid, higher delayed anaerobic threshold, increased rate of removable lactic acid, increased reduced quicker recovery rate, increased capillarization at the muscle. 22. Reaction time and speed are important fitness components required for a 100-meter sprinter. Define the fitness components of reaction time and speed and explain their importance to a 100-meter sprinter. So the examiner's report. This question requires candidates to show an understanding of 2 fitness components and to apply them to a 100-meter sprinter, showing the importance of each to the sprinter. Most candidates correctly defined speed, and many responses outlined the importance of both components. The best responses gave an accurate definition of reaction time, which did not include the word react. The time taken to respond rather than react to a stimulus was an acceptable answer. So it says reaction time, the length of time it takes a performer to respond to a stimulus, or the time between the onset of the stimulus and the initial of the response or movement. So another mark for importance. The quicker the sprinter can respond, react to the gun, the quicker they will get away from the blocks or have an advantage over their opponents. Another mark for speed, the ability to move quickly, or distance divided by time, or rate of change of position with respect of time. It says do not accept reacts in the definition of reaction time, so must use a different word. Also, we've got 1 mark for importance. The quicker they are able to move their body, legs, run, the greater the chances of winning the race, getting a faster time. So B, before an athlete participates in a sprint, they will complete a warm-up to prepare their body and mind for the race. Using practical examples, describe the components of a warm-up and evaluate the different mental preparation techniques that could be used to fully prepare the athlete for a race. So this question is a 6-mark extended response question with a level of responses mark scheme. It requires the candidates to show knowledge and understanding of the component of a warm-up and to apply that knowledge to give examples of suitable exercises for a sprinter. Furthermore, candidates needed to evaluate mental preparation techniques that would help the sprinter prepare for a race. Most responses listed some of the components of a warm-up and gave suitable examples. They also named at least 1 mental preparation technique and attempted to make some form of evaluation of that technique that would benefit the sprinter. The best responses show evidence of planning so that a logical, well-presented answer was produced. Each component of a warm-up would be described and exercises would be given. Several mental preparation techniques would also be outlined and evaluated. For example, selective attention helps a sprinter focus on the event and block out distractions, while positive thinking increases confidence and determination to do well. A few higher ability candidates also evaluated the limitations of mental preparation techniques. Although this was not required to access the highest level of response, many responses included practical applications of other sports, particularly when given examples for the skill rehearsal element of a warm-up. Candidates are reminded that their answers need to be relevant to the specific requirements of the question, and the wider synoptic link will not gain credit. While the majority of candidates responded to both aspects of the question, some candidates did not address both, or only covered one aspect superficially. In some instances, more information was provided on mental rehearsal than on the warm-up. So, just reading through the mark scheme. So we've got, if I go straight to the actual answers required. So we're looking for the components. So we're looking for pulse raiser, an exercise that increases heart rate, e.g. jogging on the spot. Mobility, an exercise that takes joints through a full range of movement, e.g. arm swings or hip circles. Dynamic, an exercise that involves a change of speed and direction. Stretching, an exercise that increases the range of movement to reduce injury. You can put static stretches or dynamic stretches. Skill rehearsal, an exercise that prepares performance for the race, e.g. short 10-meter sprints, practicing their starting technique. 6, for mental preparation, imaginary, heightened of control around arousal, e.g. the athlete using imaginary to keep calm, get in the zone before the race. Mental rehearsal allows effective, clear, safe decision making, e.g. athletes visualizing the sprint start. Selective attention improves concentration, focuses or blocks out distractions. Positive thinking increases motivation, confidence, self-awareness. 10. General evaluation of mental preparation, heightens control arousal, improves decision making, speeds up reactions, improves focus and concentration, increases confidence and motivation, self-awareness. 23. Figure 6 below shows the respiratory rate of 2 hockey players before, during and after a match. Using the information in figure 6, analyse how the 2 players' respiratory rates compare and why they may be different. So the examiner's report, the 3-mark question. This question requires candidates to analyse the data shown in the graph, and many responses did this well. For example, player A's lower resting respiratory rate suggests that he or she is fitter than B. A's respiratory rate suggests he or she did an active warm-up and an active cool-down. B's respiratory rate suggests that he may have been working harder than A during the match. Some candidates misunderstood the graph to be showing heart rate. However, if their analysis of the data was correct, credit could still be gained. So, look at the answers. We've got A has a lower resting respiratory rate, B has a higher resting respiratory rate, A may be fitter than B, B may be less fit than A. 3. A does a warm-up, B does not do a warm-up. 4. A may not be working as hard as B working harder than A. 5. Suitable references of different playing positions for A and B, e.g. A may be in defence while B may be in midfield player. 6. A does a cool down, B does not do a cool down. 7. Both players have almost returned to the resting respiratory rate after 15 minutes. B. Explain the role of the respiratory muscles during inspiration while player A is performing in the hockey match. So, examiner's report. Some responses to this question were very detailed and showed excellent understanding of the mechanics of breathing. Higher ability candidates stated that the diaphragm and external intercostal muscles contracted during inspiration, causing the ribs to move up and out. This increased the volume of thoracic cavity, decreasing the pressure inside the lungs, which resulted in air being drawn in. Some candidates described the structure of the lungs and explained why more air was needed in the lungs. This knowledge was not required by this question. So the answer: external intercostal muscles contract. 2. Diaphragm contracts and flattens. 3. This pulls or moves the rib cage up and out. 4. Increases the volume of thoracic cavity. 5. Decreases the pressure within the thoracic cavity, thorax, lungs, or pressure within the thoracic cavity is less than the atmospheric pressure. Do not accept more space in lungs. This is too vague. Decrease in pressure on its own is also too vague. C. Analyze the effects that lactic acid could have on performance and recovery of the hockey player. So the examiner's report. Many candidates produced detailed responses which explain that lactic acid causes pain and has a negative effect on performance. Others highlighted that the buildup of lactic acid causes fatigue in muscles. Most responses recognised that the question required an effect of lactic acid on recovery and correctly stated that lactic acid increases recovery time. So, mark scheme. So, sub 2 marks max. Causes fatigue in the muscles, causes pain, discomfort, soreness, resulting in increase in performance. Players A's warm-up may lead to less lactic acid buildup. 5. Recovery will be longer if the lactic acid has built up or slows down recovery rate. 6. Lactic acid causes HRBR to stay higher than normal. It says do not accept cramp in your answer.